While vitamins are essential for maintaining good health, it is important to remember that excessive intake of certain vitamins can be toxic to the body and may lead to some dangerous health problems. Here are some vitamins that, when consumed in excessive amounts, may have toxic effects. Vitamin A. Acute toxicity. Excessive intake of vitamin A can lead to a condition called hypervitaminosis. Acute vitamin A toxicity can lead to increased intracranial pressure, resulting in symptoms such as headache, dizziness, and in severe cases, altered mental status, and even loss of consciousness. This condition requires immediate medical attention. Cognitive impairment. Chronic vitamin A toxicity has been associated with cognitive impairments, including confusion, memory loss, and difficulty concentrating. These cognitive effects may be reversible with appropriate treatment, but they can persist if vitamin A intake remains excessive. Neurological symptoms. Excessive vitamin A intake can cause a range of neurological symptoms, including irritability, agitation, and behavioral changes. In severe cases, it can lead to symptoms such as seizures, tremors, and ataxia, loss of coordination. Chronic toxicity. Dermatological effects. Long-term excessive intake of vitamin A can cause dry, itchy skin, and in severe cases, it may lead to skin peeling, cracking, and increased vulnerability to infections. Bone and joint pain. Vitamin A toxicity can lead to skeletal issues such as bone and joint pain, as well as an increased risk of fractures. Liver damage. Prolonged excessive vitamin A intake can cause liver toxicity, potentially resulting in liver damage or hepatitis. Birth defects. Pregnant women who consume very high levels of vitamin A, particularly in the form of retinol or retinoid supplements, are at an increased risk of birth defects. It is recommended for pregnant women to avoid excessive vitamin A supplements. Vitamin D. Excessive intake of vitamin D can lead to vitamin D toxicity, also known as hypervitaminosis D. Here are some potential adverse effects associated with high doses of vitamin D. Hypercalcemia. The most significant concern with excessive vitamin D intake is the risk of developing high levels of calcium in the blood, a condition called hypercalcemia. Symptoms of hypercalcemia may include nausea, vomiting, loss of appetite, excessive thirst, frequent urination, abdominal pain, weakness, and confusion. Severe hypercalcemia can lead to kidney stones, kidney damage, and calcification of soft tissues such as blood vessels and the heart. Calcium deposits. Prolonged and excessive vitamin D intake can lead to the deposition of calcium in soft tissues, such as the kidneys, heart, and blood vessels. This can contribute to the development of conditions like nephrocalcinosis, calcification of the kidneys, and cardiovascular calcification. Kidney damage. Chronic vitamin D toxicity can cause damage to the kidneys. Elevated calcium levels resulting from excess vitamin D can strain the kidneys, potentially leading to impaired kidney function. Vitamin C. When consumed in excessive amounts, vitamin C, ascorbic acid, can lead to certain toxic effects. Here are some potential adverse effects associated with excessive intake of vitamin C. Gastrointestinal disturbances. Taking high doses of vitamin C can cause gastrointestinal disturbances, particularly diarrhea, abdominal cramps, and nausea. These symptoms are usually self-limiting and resolve once the intake of vitamin C is reduced. Kidney stones. Excessive intake of vitamin C can increase the risk of developing kidney stones in susceptible individuals. This is because vitamin C is metabolized into oxalate, a compound that can contribute to the formation of calcium oxalate kidney stones. Iron overload. Vitamin C enhances the absorption of non-heme iron from plant-based sources. While this is usually beneficial, excessive intake of vitamin C in individuals with iron overload disorders, such as hemochromatosis, can further increase iron absorption and potentially worsen the condition. Interference with medical tests. High doses of vitamin C can interfere with certain medical tests, such as blood glucose measurements and occult blood tests. It is important to inform healthcare professionals about vitamin C supplementation before undergoing these tests to ensure accurate results. Vitamin E. Excessive intake of vitamin E can lead to potential toxic effects on the body. Here are some adverse effects associated with high doses of vitamin E. Increased bleeding tendency. Vitamin E acts as an anticoagulant and can interfere with blood clotting. Consuming large amounts of vitamin E may increase the risk of bleeding and bruising. It is particularly important to exercise caution if you are taking blood-thinning medications or have a bleeding disorder. Gastrointestinal disturbances. High doses of vitamin E can cause gastrointestinal symptoms such as nausea, diarrhea, and stomach cramps. These symptoms are usually mild and resolve once the intake of vitamin E is reduced. Increased risk of hemorrhagic stroke. Some studies suggest that excessive vitamin E intake, particularly in the form of supplements, may be associated with an increased risk of hemorrhagic stroke. However, more research is needed to fully understand this potential association. Impaired immune function. Although vitamin E is known for its antioxidant properties, very high doses may suppress immune function, potentially increasing the risk of infections. Vitamin B6. When taken in large doses, vitamin B6, pyridoxine, can have toxic effects on the body. This condition is known as vitamin B6 toxicity or pyridoxine toxicity. Here are some potential adverse effects associated with excessive doses of vitamin B6. Sensory neuropathy. Prolonged consumption of very high doses of vitamin B6 can lead to sensory neuropathy, which is characterized by numbness, tingling, and pain in the hands and feet. This condition may be reversible if the intake of vitamin B6 is reduced or discontinued. However, in some cases, the nerve damage caused by excessive vitamin B6 intake may be irreversible. Neurological symptoms. Vitamin B6 toxicity can cause neurological symptoms such as difficulty coordinating movements, clumsiness, and loss of balance. These symptoms can resemble the characteristics of peripheral neuropathy. Skin lesions. Excessive intake of vitamin B6 may result in skin lesions, including photosensitivity reactions and rashes. Gastrointestinal disturbances. High doses of vitamin B6 can cause gastrointestinal issues such as nausea, vomiting, and abdominal pain. So in the end, it's important to note that the above-mentioned toxic effects are relatively rare and usually occur with high doses of vitamins, well beyond the recommended daily allowance, RDA. Therefore, one must be very cautious while taking vitamin supplements.